And
Recording in progress.
Hand it over.
Perfect. So thank you so much, Hannah, for the introduction and for having us here again. We are very happy to be able to be here with all of you. As Hannah said, my name is Marta Garnelo. I'm gonna lead the first half of the presentation around who we are, what are behavioral insights, and my colleague Leah is gonna walk us through some of examples of what has been our work with states, and we hope that this also sparks inspiration of how could you apply these methodologies to your own work. So on the goals for today, as I was mentioning, first, we want to provide you a brief introduction to BAT and also behavioral science. I know it can sound kind of abstract. So what do we mean by behavioral science and how does this look in practice? Then we're going to learn about BAT's EAST framework. EAST is actually an acronym. It stands for easy, attractive, social and timely, and it's our framework to apply behavioral science to public policy challenges. And then we hope to have some time for discussion, but please, if there are any burning questions you have during the presentation, feel free to jump in, interrupt us, and we are also, as I was saying, looking forward to hear from you and how you see the applicability of these methodologies to your own work. So first of all, what do we do? BAT is, we were just talking about it with Hannah at the start. It is a social purpose company. We were born as part of government, actually. It's kind of on our DNA to be government focused. And our mandate is to apply behavioral science, and we define behavioral science broadly. It entails like behavioral psychology, but also behavioral economics, anthropology, neuroscience. So how can we bring that knowledge, those different disciplines that study rigorously human behavior, to improve policies and service design to ultimately get better outcomes for people? We do that with rigorous evaluation. So we always say that when we started out, no one would have believed us that these small changes, tweaks, smarter policy design could have such a large impact if we hadn't evaluated what's the impact of what we do. And then finally, we also do quite a bit of capacity building through workshops like this one, but also longer engagement, for example, with agencies that want to build their own behavioral science teams. So what do we mean by a behavioral insights approach? And first of all, I wanted to start with a small game. And partly because for those on the East Coast, we're right after lunch, but I think anywhere just to give a bit of a practical illustration of why behavioral insights and behavioral science are important. So first, I'm going to show you a list of words, and you don't need to do anything at this point. I'm going to just read through the list, read through it with me, and then just take it in and try. I'm going to ask you after these to try to recall as many as you can, but do not take any notes right now, like just read through the list with me. So the list is bed, rest, awake, tired, dream, wake, snooze, blanket, doze, slumber, snore, nap, peace, yawn, and drowsy. Okay, so now if you have a piece of paper or even in your computers, if you can take a moment to try to write down as many words as you remember. Just give folks a few seconds. Okay, perfect. And then I don't know if I think people can raise their hand, but either if you can or raise your hand on Zoom, or even just drop a line on the chat, say yes if you remember or not. And please tell me whether you remember these words. So bet, how many of you remember bet? Okay, a few people remember bet. How many of you remember wake? Perfect. Then sleep. How many of you remember sleep? Perfect, also a few people. And then finally, how many of you remember nap? Some yes, some no's. Okay, great. So what is the trick of this exercise? And it's actually that sleep is not in the list. And what you shouldn't feel bad if you remember sleep, not the least because I did remember sleep first time that I ran through this game, but also because what your mind is doing there is something really smart. It's actually engaging in pattern recognition. All of these words have something to do with sleep. It's just that the specific word is sleep is not in there. So when we run these exercises, around 40 to 55% of people falsely recall the sleep. And that we wanted to use to illustrate how actually the content in which information is presented to us. Here we had a bunch of words all related to sleep, except sleep. It can influence, actually has an impact on what we remember or don't remember. And then another case study that I wanted to show you is, imagine that you want to buy a subscription to The Economist, and you can replace The Economist with another magazine that you find more interesting, name it National Geographic, or depends on, I guess, your preferences. But imagine that you have 3 options to choose from. The first one is an online subscription for 1 year for $73. That's the cheapest option. The second option is a print subscription for $154. And then the last option is both online and print. So having online access and also receiving it in email. And that has the same price as the second option, that is $154. So when the researchers in this study posed the question to a group of MBA students, you wouldn't be surprised to discover that no one chose the middle option, the only print, only receiving the magazine in the mail, partly because the print and online access had the same price, right? So it was definitely the worst option of them all. But then what happens if we remove that middle option, that option that we knew from the start wasn't that appealing? So preferences actually flip. So if when we have these 3 options, most people, 72%, choose print and web, when we remove that middle option, the majority of students would choose an online subscription. So as you can see how choices are presented to us influences our preferences. If it weren't because that, what we call the decoy option, that option that actually wasn't that good, most people would have chosen the online only subscription. So in a sense, these insights matter in the real world, have consequences, and can have an impact, sway our choices, have an impact on our preferences. And to bring it to the public policy field, what are some examples of how this has been applied to social challenges, to public policy challenges? So this is an example from the UK, in which what the government or the challenge that they were facing is, how do we get people to save for retirement? Many of us don't save as much as we should to have the standard of living that we would wish when retirement comes. So they were thinking of what are potential policy alternatives, policies that we can implement to get people to save more for retirement. And the policy until 2012 had been that if you want your employer, if you're a salaried worker and you want your employer to contribute part of your salary to a pension plan, the equivalent to what in the US would be a 401k, you had to proactively let your employer know. Tell them hey, I want you to pre-tax direct 5% of my salary towards a pension plan. And over the years, and this happened gradually because they started first with the large companies, going all the way down to small business, they changed it that instead of the default being opt-in, that you had to explicitly say that you wanted to contribute to a pension plan, you had to opt out. So you had to, like, your employer would automatically every fortnight, like, or every month, direct part of your salary towards a pension plan. And if you didn't want that to happen, you had to explicitly tell your employer, like, please, I do not want to contribute towards a pension plan. And that small change, that opt-in versus opt-out, made all the difference and really had a large impact in increasing the proportion of workers that were saving for retirement. So in that case, as you can see, is those small nuances that can have like a large impact on people's behavior. So what I want you to walk away with today is that understanding how people behave, what drives our behavior, how we make decisions in practice, not necessarily according to a theoretical model in which we are all rational beings, but like how do we make decisions in the day-to-day, can help us design better policies and services. And you may wonder, like, how can we incorporate this in like your day-to-day and the policies that your agencies currently implement? Something important to note is that behavioral insights is not meant to replace the tools in a policymaker's toolkit, but rather like to complement it. Like, it's supposed to help you make your policies, your interventions more impactful, more effective. So, and in that regard, like, behavioral insights can be applied to traditional policy interventions, for example, providing information, designing the environment. We've been recently doing a lot of work on traffic safety. How can you design the built environment so that you discourage people, for example, from speeding before a left turn, or that kind of intervention in like the physical space. It can also be applied to process design, to incentives or rewards and sanctions, and also to rules and regulations. And what do we do, or what are the methodologies that we apply, like, to really understand, like, what are the motivations, what are the barriers to behavior change? So on the one hand, part of it is doing observations and having firsthand experience with a given government policy or process. It's if you, for example, are hoping to improve the process by which people get their driver's license, one of the best things you can do is go through the process yourself, right? Like, to try to identify what are those pain points. Then something else that we use at this stage is, what administrative data do we have? What are the patterns? What are things that are difficult for people? Like, what are like potential barriers, or it may point us towards potential solutions. And then also just talking to people, talking to end users, to frontline workers, that many times they are the ones that know the challenge or the problem at hand best, and that are going to have like excellent ideas on how can we incorporate insights from behavioral science and about human behavior to make those policies better. And then finally also doing secondary research, so understanding what has worked elsewhere, like what do we know about how people behave, and how can we bring it to adapt it to this specific context. And then something that I mentioned at the beginning, but that is a key component of implementing behavioral informed policies, is trying to understand what works and what doesn't. So I was mentioning on the importance of evaluating the impact of policies and services. And the methodology that we normally use to do so is randomized controlled trials. The name may be familiar because that's the methodology that it's used to evaluate what's the effectiveness of drugs, of medications. And the basic mechanics is that once you have like, what is your target population? What is the target population whose behavior you want to influence? And it can be individuals, but it can also be like institutions of groups or groups of people, for example, in education, schools. You randomly assign those to a treatment and a control group. The treatment or intervention group is the group that is going to receive this behavioral informed policy or service, and the control group is going to receive business as usual. And by assigning people to those two groups randomly, you're ensuring that they are statistically similar, like statistically the same, so that when you then measure the outcomes for both groups, you can compare. And if you know that if there's any difference, is it due to that difference is going to be driven by your intervention and not by other factors. And one question that we get asked often is like, why go through that much trouble? Like, if you think that a policy is going to work, shouldn't you just implement it, try to scale it up, and observe like what does the data look like after you've implemented the intervention, instead of going through kind of the effort of implementing a rigorous evaluation. So the key message here is that it is important to evaluate the impact of interventions, partly because what may seem like common sense, or like that there is like a sound hypothesis, I guess, that something is going to work, it may not turn out to be the case. And there are like a lot of examples in public policies of things that sounded good, that were like, there were good intentions behind them, and then at the end they didn't have the impact intended, or in some cases they may have even been harmful. So the case on the screen, it is from a series of studies that were conducted in the US and in Australia, and they were trying to evaluate a policy that was common in some school districts to try to prevent unintended pregnancies among adolescents, among teenagers. They were given teenagers what they call robo-babies, or like infant simulators, that were like these toys that would need to be fed, would cry, had all these kind of needs that you needed to pay attention to. And the idea was to try to deter, in a way, or like show adolescents like the responsibilities that raising a, like taking care of a baby entails, and encourage them to delay pregnancy in that regard. But what they found when they evaluated this in Australia is that actually the intervention backfired. So in the schools where they implemented this intervention, this program, actually it was more likely that teenagers had kids early. So in that regard, like, this is only one example, but as I was mentioning, there are like a lot of cases of this happening. So I think it's just a reminder of how important it is to really measure, like, are we achieving our goals or not, as a way to also prevent unintended consequences. And I think that's all from me. I'm going to hand it over to Leah, who's going to talk us through the EASE framework and how can we use it to apply behavioral insights to public policies.
Thanks so much, Marta. So if we go to the next slide, Marta spoke earlier about the EASE framework and what it is, but essentially it's a tool that the behavioral insights team developed to capture some of the most fundamental elements of behavior change. So basically it's this acronym that helps you remember that when you want to shift behavior, you want to think about how to make your target behavior, whatever it might be, easier for folks to do, how to make it more attractive, how to make it more socially compelling to your target audience, and how to make it more timely. So I'm going to go through what each of those mean, and then talk through some examples of behavioral insights at the state and local government level. So starting off with the E, making it easy, there are lots and lots of different things we can think about doing to encourage behaviors by making them easier. This one all the way on the left, setting intelligent defaults, is probably one of the most powerful tools in the behavioral science toolbox, because a lot of them, or a lot of us rather, let inertia guide us through many of the decisions that we make throughout the day, many of the behaviors that we perform throughout the day. And the reason we do that is because our poor brains would be exhausted if we made effortful decisions at every single moment. So these kinds of behaviors around setting defaults, you can think of a subscription that auto-enrolls you into the next month or into the next year, sticking with the same internet provider over different periods of time. It's kind of thinking about, like, I'm on a track, I'm going to stay on the track because it's the easiest thing to do. In the middle here, when it comes to reducing the hassle of performing a behavior, the thing to remember is that every little friction counts. So when I say friction or friction costs, that refers to the amount of effort it takes to complete a behavior. So even seemingly small little extra bits of hassle or frictions can make it less likely that people follow through on doing something. So for example, if you think about someone who's filling out a form on a government website, every extra click, every extra time that they have to input information, even though these are small things, they might get less likely that someone makes it all the way to the end in kind of a straw breaking the camel's back way. And then finally, shortening and simplifying messages and processes can take us a long way when we want someone to perform a behavior. And this is something we see a lot, something that I definitely do when I think about applying behavioral insights to my own life and work, just to sort of to start off with on a first pass, is there anything that I can do to make whatever I've just written or created shorter and simpler and easier? So just to walk through a quick example of this, the challenge in this case was how to boost flu vaccines among the elderly. This was in the UK. And when it comes to vaccines, we can think of lots of different frictions that could apply. You might have to wait in line at the clinic. You might have to book an appointment ahead of time. You might need to travel to get to the clinic. And a barrier doesn't need to be big for it to stop someone from doing something, even something that could help them a lot. It could be as small as having to look up that phone number to make your appointment, or having to find the right link on the website, or having to go get your insurance card out of your bag. They can be small things that kind of prevent you from getting over the line. So the study in this case evaluated the impact of reducing the friction cost of having to actually travel to go get a flu vaccine. And it found that offering older folks over the age of 75, the flu vaccine as part of a home health check increased uptake compared to sending out invitation letters for a flu vaccine appointment at the health clinic. So just removing some of those steps, the step where they had to make an appointment, the steps where they have to get to the appointment, were really effective in getting a lot more people their flu shot. Sometimes a target behavior is something that you don't want people to do. So sometimes we're trying to shift behavior away from something negative. And in that case, you might actually want to make that target behavior, the negative behavior, harder or more effortful to do, or to kind of interrupt that default thinking we were talking about earlier. So in this case, the Office of the Attorney General in New York partnered with us to reduce source of income discrimination by landlords. So lawful source of income is a protected category under New York state law, includes any federal, state, or local public housing assistance toward paying rent. But we see this a lot, that landlords and real estate brokers continue to turn away some potential tenants who use different subsidies to pay their rent. So in this case, one of several recommendations that we proposed had to do with changing what this kind of perceived path of least resistance would be for a landlord. And otherwise, the inertia of what they've always done of treating potential tenants in this way would likely have continued as sort of their business as usual path forward if it's what they've always done. So we're taking that kind of default thinking, this is how I treat this category of tenant, and taking that default option away from them by framing non-compliance as a deliberate act. So the draft example on this slide on the right is that the Attorney General's office will view any kind of illegal discrimination against voucher holders as an intentional choice of the landlord, not as an accident or oversight. So again, taking away that kind of default thinking sort of excuse. And we've seen success on this type of intervention in the area of tax compliance. So on the left here is kind of a similar example where we designed an intervention that frames noncompliance as a deliberate act, again, rather than an act of omission. So this is one that hasn't been evaluated yet, but if you're working on something similar, then definitely get in touch and we can chat. Okay, next on our East agenda is attractive, A for attractive. So the first thing we want to think about in terms of this attractive element is attracting attention. So behavioral scientists often use the term salience to refer to people's tendency to pay attention to different stimuli that are novel, alarming, maybe colorful, that surprise you, that are more accessible to you. I think grocery stores are great examples of this. There are a lot of things in the grocery store that use salience very intentionally, that will use the shape or color of an item to attract attention. Or they'll think about where it's located in the store, putting something at the end of an aisle, putting something at eye level, putting something at the eye level of a child. All of these things are deliberate mechanisms to attract attention. Personalization is sometimes less apparent, but it's a simple but quite reliable tool that can win a lot of us over much of the time. So if you think about being in a busy room and you're able to hear someone saying your name, that's kind of the effect of personalization. You're more attuned to it. Another one I think about sometimes is when you're out of your home state or out of your home country, and you hear your hometown being discussed by some people in your vicinity. It stands out to you and maybe even triggers something kind of small and sentimental inside you. So including these kinds of personal details in a message can increase engagement, can increase response rates, and it all comes back to that personalization. And then the final piece in making something attractive is using rewards and incentives. So it will come as no surprise that financial incentives and other types of incentives are sometimes highly effective to make a behavior more attractive. But I do want to caveat this one by saying it's an area where we tread carefully, because we wouldn't want to design financial incentives that crowd out intrinsic examples. So for example, if you have a situation where lots of people are compelled to do a behavior for intrinsic reasons because they care about a cause, for example, then a financial incentive can kind of clash with that. And additionally, we don't want to do something that's going to have a corrosive effect on trust. So for example, if you're paying someone a bunch of money for something they would do anyway, then they might think, what's the deal here? Why are you why are you trying so hard, in a sense? So rewards and incentives can be very effective, but definitely tools that we want to be really thoughtful about. And as Marta said earlier, make sure that we evaluate and understand what kind of impact they're having. So as an example for this one, this project is about protecting kids from lead poisoning. So lead poisoning, as the folks on this call will be aware, is silent and can be deadly and is particularly harmful for children. And while the most common source of lead is in paint, testing water for lead is actually the second most important way of preventing lead poisoning. So in this particular project, our goal was to increase the uptake of Chicago's lead testing program. And at the time that we started working with them, only about less than a third of residents who requested a lead testing kit returned it back to the city. So of the proportion who had requested the kit in the first place, only a third are going back to the city and able to be analyzed. So what we're looking at on the screen here is the original kit instructions. And I know it's too small to read here, but even looking at the zoomed out version, just drop in the chat what some reasons might be that people wouldn't complete this process. Just sort of looking at this from what you can perceive as the overall picture. What are some reasons that people might not complete this process? Okay, I'm seeing a lot of, overwhelming, complicated, too many words, very long, not enough pictures. Absolutely agree with all of these things. Marta, if you click next, some of the reasons that we heard from residents. Oh, sorry, just back one. Perfect. So there we go. I think the main barrier that we identified aligns with a lot of what folks are saying in the chat, that people just found the materials and instructions confusing and overwhelming. And additionally, residents sometimes incorrectly completed the kit because they misread the instructions or incorrectly recorded information. So sometimes they sent the kit back, but because they had recorded something wrong, it wasn't able to be analyzed. Additionally, in some cases, they did complete the kit, but it had been moved or damaged before it got picked up, or the pickup instructions weren't clear, and so they never put it out or scheduled a pickup. So lots of different reasons why ultimately these kits weren't getting across the line and being tested. So if we go to the next slide, in our redesign, we really wanted to think about where folks' attention was going. And sorry, I just saw a comment from Madeline in the chat. Was there a follow-up for participants who didn't submit the test? I don't know about a follow-up from the city, but those reasons I just talked through were from folks who were affected by this particular program. So on this is the first side of the new kit instructions, where we've got this infographic that helps residents understand some of the steps that were more commonly misunderstood. It guides your eyes more clearly through the process by simplifying it into these 3 easy steps. So it makes it just easier overall to understand what you need to do. We've highlighted the contact information at the bottom and added a QR code to make support options more salient. And then on the back, on the next slide, we also use some of these same sort of attention-grabbing elements to chunk information and use visuals to make it overall easier to understand. The bottles that you see on the screen there that are in different colors corresponded to bottles in the actual kit, so that it was more straightforward so that color coordination could grab your attention, and it's more straightforward to say, okay, this is the piece that corresponds to this step. And then we really emphasize scheduling and pickup so that people don't fall off at that stage. And it's easier to kind of complete that immediately right after the sample has been collected. The final piece we added here were these stickers. So in the new kits, they got 4 of these don't use stickers that they could put on taps, on toilets, on washing machines, any other appliance that uses water, as a reminder not to use water for the period of time when they're doing the water collection. And then there's this do not move sticker that would go on the outside of a box when it's being set out to pick up. So that's to prevent any other members of the household or neighbors or other folks in the building from moving this around before someone from the city has a chance to go and collect it. So all of these changes ended up working super well. The evaluation you can see on the screen looks a little bit confusing with all of the lines, but if you click next once, Marta, there we go. So that top group are folks who received the redesigned kits, and the bottom group received the original kits. This is done month to month. So all of the months in the top kit, or all of the lines on top correspond to the redesigned kit, and the ones on the bottom to the original kit. And you can see that the new kits had a much higher average return rate. Because of this kind of smart attention design kind of reconfiguration. Okay, quick pop quiz. It's very important that you get all of the questions here right. There are huge consequences if you don't. But we will, if we go to the next slide, the first question for you to drop your answer into the chat is, was Mahatma Gandhi older or younger than 50 when he died? Okay, I'm seeing a lot of olders, a couple of youngers sprinkled in there. Someone has identified this as a trap. Okay. So moving on to the next question in the quiz, how old was Gandhi when he died? And we're just looking for a best guess here. It's no judgment on anyone's Gandhi history. Okay, we've got a few numbers still coming in. The next question is going to be Was Albert Einstein older or younger than 100 years old when he died? Okay, here it seems like we're a little bit more unanimous. I think I saw one older sprinkled in there, an optimist perhaps, but it seems like most folks think he was younger than 100 when he died. And our next question is, how old was Albert Einstein when he died? Okay, so seeing a lot of answers in the 70s, a couple in the 80s, a couple of 60s in there. All right, if we go to the next slide, the big reveal, how many people guessed that Gandhi was under 78? All right, so we've got many folks who fall into that category. And then on the other side, how many people guessed that Albert Einstein, who died when he was 76, guessed that Albert Einstein was over 76 when he died? So as you're reflecting on your answers, the key takeaway here is that what we call anchors can affect our assessments, especially regarding information that we're not sure about. So most people, myself certainly included, aren't aware with a lot of the specific details of the end of these two folks' lives. Weren't aware necessarily coming into this call that you'd be quizzed on how old they were. And so we're using other sort of pieces of information to put together a mental picture that might provide the answer to this question. And in this case, the anchors that I provided could let your brain sort of take this cognitive shortcut. So answering whether or not Gandhi was over 50 when he died is a little bit trickier because maybe you're thinking, okay, I've seen some pictures of Gandhi that look like he's around the age of 50. He might have been older. Maybe he was a little bit older, but he could have been younger. You're using 50 as sort of like an anchor. Was he a little bit younger, a little bit older, or a lot older? Versus for Einstein, we can, most of us safely say, okay, I'm not exactly sure when Einstein died, but I'm pretty sure he was less than 100. But you're using 100 as this sort of anchor. So from 100, we're going down from there, and it affects our assessment of the final answer. So just a kind of a fun game to show how anchoring can affect our assessments and decision making. Okay, so moving on to the third East element, which is about making decisions and behaviors more social. So the most important component, I think, of thinking about the social element of behavior change are what we call social norms. So these are our perceptions of what most of the other people in a group are doing, or what most people think is the right thing to do in a given situation. And this is especially powerful when it's your community or your peer group or people in your immediate vicinity who are doing a particular behavior. So, you know, when people stand up, we often stand up with them. If everyone claps, we often clap with them. We, generally speaking, don't like to deviate too far from what others are doing, especially in sort of a close or familiar context or in a context with other people who we know and respect. So the reason I have hand washing on the screen on the left there under social norms is that hand washing is a behavior that's very strongly correlated with perceptions for the behavior. So hand washing as the behavior strongly correlated with folks' perceptions of hand washing among others. If social norms then are what everyone else in the room is doing, then the way that we use networks is more about what a few special people in that room are doing. So thinking about people who you know well, who you trust, who you admire, people in your network essentially who might influence your behavior. This kind of brings us to what we call the messenger effect, which is the idea that certain messages land better when they come from specific people, or land differently when they come from specific people. So an example here might be if you're thinking about what food to buy for your toddler, then hearing an actor say you should always buy organic food is going to mean something different to you than hearing your pediatrician say you should always buy organic food. And that's kind of how we think about the messenger effect. Then the final one that we think about for making it social is around, it's sort of a two-part one. So final two, we'll say commitments and reciprocity. So reciprocity is this idea that when someone does something for us, then we have this strong urge to repay them with something. The way that I think about this is when you're at the farmer's market or any kind of food market where someone is offering samples, then oftentimes you feel obligated, if you've taken a sample from somewhere, to go and look at whatever that person is selling. Sometimes if then you talk to someone for a little while and they're being really friendly, maybe they spend a lot of their time giving you more information about the product, then you feel obligated to buy one. That's reciprocity in action. Commitment devices, on the other hand, are when we tell friends or others in our immediate communities about our intentions to do a certain behavior, so that we will be more likely to follow through on the behavior, because we know, we told that person we would do it, and we don't want to kind of let them down or fall short in their eyes. So for example, if I wanted to learn Spanish, if I told some of my coworkers that I'm learning Spanish, then I know that they might follow up with me and ask me, how's that Spanish goal coming along? And if I haven't done anything about it, if I haven't taken any classes, or if I haven't practiced, then I'm going to have to report that back to them, and it doesn't feel good. So this idea of sort of a public commitment to others in your network. So an example of using social norms to change behavior, as folks know on this call, when you get antibiotics, something that is often emphasized by healthcare providers is that you really need to take the full course, because otherwise the strongest bacteria survive and you get these superbug strains, or what we call antimicrobial resistance. And the overprescription of antibiotics, particularly in situations where they're not medically necessary, like viral infections, is a behavior that's linked to antimicrobial resistance as a global public health challenge. So in this case, we were working on getting doctors to not prescribe antibiotics when they're not necessary. And the way we did that was by taking all primary care doctors. This was a trial that we did in the UK. So we took all the primary care doctors, then looked at the top 20%, the folks with the highest prescription rates in their local areas, and split that group, the sort of problem children, the overprescribers, into two groups. So we randomly selected them and put them in one of two groups. Half of those top overprescribers received a letter, that's what you see on the slide here, informing them that 80% of their peers, so of other primary care doctors in their area, prescribed fewer antibiotics than they did. So it really emphasized this social norm of saying, look, we're not telling you what to do, but the way that you practice is a deviation from the way that others in your peer group are practicing. And then the other half of the overprescribers didn't receive a letter, so they didn't get this this social norm highlighted to them. And in terms of what happened, the letter intervention was really successful. That's the most important outcome, is that it led to a decrease in overprescribing, but it also cost a fraction of the overall budget to reduce antibiotic prescribing. So just to talk through what you're looking at on the slide here, the dark line is the treatment group. So those are the ones who received the letters. And as you can see at every point in time, they're prescribing fewer antibiotics compared to the control group, which is what we want. So the UK had set aside 23 million pounds, which is at the time was about $31 million to change the prescription rate by a percentage point. That was their goal, to drop the prescription rate by a percentage point. And the cost to implement this trial was £5,000, so less than $7,000. And we got them 85% of the way to their goal. So it's just to sort of illustrate what Marta was saying at the beginning, that sometimes these small and relatively simple affordable interventions can really make a big difference. And a percentage point might not sound like a lot, but when you bring it to a population level, and for us on this call, thinking about the entire population of your state, there are some real consequences to what a percentage point means. So in this case, the letter saved 73,500 doses across almost 800 practices. It led to over $125,000 saved in the public sector for prescription costs. And then again, most importantly, it brought down that prescribing rate and helped prevent the rise of antimicrobial resistance. So it got the UK 85% of the way to that goal. Okay, we're in the final stretch. The last letter of EAST is about making a behavior more timely to encourage folks to enact it. So the elements of making a behavior timely include prompts and reminders. And what I really want to emphasize here is that when we're thinking about prompts and reminders, the important thing is to consider the most appropriate time to reach someone. So for example, if our target behavior is reminding cyclists to wear a helmet, it's much more useful to reach them in the morning when they haven't left their house yet and they're still able to grab their helmet on the way out the door, compared to in the afternoon when maybe they're leaving the office. But if they didn't bring the helmet in the morning, then it's kind of a moot point because the helmet's not there. Another one I think about a lot with prompts and reminders is when you're going into the grocery store, you really need to be reminded to grab your reusable bags before you leave the car, or in some cases, if you're using public transportation, before you leave your house, right? At the point that you're at the register, it doesn't help to get a reminder to use a reusable bag because it's not with you. So just thinking about sort of what is this user journey and where is the most effective kind of point to reach someone. A second thing we think about a lot in terms of making behaviors more timely is helping people plan their actions. So sometimes this can help eliminate the gap between what people want to do, what they think they're going to do, and then what they actually do. And the way that planning does this is by prompting people to think about the barriers to what a given action might be, and then develop specific plans to overcome those, and thereby sort of reduce that gap between the intentions that someone might have and the actual behavior they end up doing, whether that's getting a flu shot like we saw in the beginning, or voting, or something smaller like maybe you're trying to eat less of a certain food, or whatever it might be. It just kind of helps you think ahead to your future self and say, what are some of the barriers that I might want to overcome here, and what am I going to do to keep them from becoming problematic. The last piece on making a behavior timely is around discounting. So in this case, we're talking about discounting time. So we're more influenced by the costs and benefits that take place immediately than those that are delivered later. This is really common if you think about, for example, insulating your house. That's something that has a high financial and time cost right now, but it has considerable rewards down the road that will outweigh those upfront costs. But what we think about is the upfront cost, because that's what's going to cause us pain and stress and discomfort at this moment. And those rewards are kind of at this point in time ambiguous and far down the road. At least that's kind of how your brain can process these things. So in terms of policy making, what we want to pay attention to is whether or not there can be an immediate benefit placed upfront to make that target behavior more present focused. And the last kind of story or example I want to talk about here in terms of how to make interventions or make behaviors more timely is from Denver. So this is about following through on license renewal deadlines. In Denver, vehicle owners are required to renew their license plates once a year, like in many other places, and there are a lot of these to be processed. People complain about long lines at the DMV, so the city created an online option for doing this renewal, and they thought this is going to be perfect. It's going to reduce wait times. It's going to save the time of government workers. Who wouldn't want to renew online instead of going in person? But the uptake of online services wasn't where they wanted it to be, so they weren't seeing all of those savings in terms of the time of the government workers or increased customer satisfaction. So we partnered with them to help with this. And it was pretty quickly clear in this project that it was a timing issue. So people need to know about this option when it's relevant for them to do something about it. So if you're 6 months away from your renewal, then it doesn't really help you to learn about this online option, because your brain probably won't catalog that as a very urgent piece of information to remember. And then we also want to help them put that online option into their mental plan for how they're going to renew, because especially if this is something they do every single year, then that mental plan includes, okay, now it's time to renew. That means I have to go to the DMV, even if it's going to be miserable. I'm going to do it. I'm going to wait in line. So we want to shift that planning process. So we designed some planning prompts. At the time we were doing this, everyone was currently receiving a mailer 6 weeks before their expiration date, telling them they needed to renew online and giving them the important information they needed to do that. But some in this experiment we did, we split the whole population into 3, randomly allocated folks into one of 3 different groups. One group, the control group, got the sort of business as usual mailer, and then the other 2 groups would get one of 2 redesigned mailers that help them create a plan. So the middle one here uses some planning tools to help folks think about, okay, what are the steps involved here? When am I going to do this? How am I going to do this? And then over on the right, similarly, there are some planning tools that help people think through the actual mechanics of following through on this behavior. And there's also a checklist to help them think about, okay, what have I done and what is remaining to do? So before we go to the next slide, do folks want to put in the chat which one you think performed the best? The options are control, planning, or checklist. Which one do you think got the most people to shift to online? So we've got a lot of checklist folks, it looked like. I saw a planner in the beginning, one control, planning again. Okay, a few plannings. Let's go ahead and switch to the next slide. So the best performer, drum roll, Marta, if we can go to the next slide, was the planning postcard, but not by too much. So whether you put planning or checklist, you did pretty well. So the planning postcard asked you to give a date for each step that performed significantly better than the original postcard. And again, the checklist postcard also did very well and was pretty similar to the performance of the planning postcard. And if we were to scale this up, this increased by almost 8%, we'd see 9,000 additional online renewals across the city, which is, again, significant, especially when you think about the fact that this is just changing the design of something that's already happening. So there's very little involved in terms of cost or additional administration to implement these changes. Okay, so that was a lot of me talking, and I know there's been some conversation going on in the chat. Before we open it up to questions, I just wanted to sort of wrap up with a couple of concluding thoughts or takeaways. The first being that behavioral insights can help us identify the predictable patterns in how humans interact with policies and programs. And the important piece here is that we're interested in working with these patterns and biases and heuristics that we see in behavioral insights rather than against them. So it's not about changing the way that people think necessarily. It's about working with the way people think and with their preferences to get them to the desired outcome. Second key takeaway is that evaluation can help us narrow in on what works, when, and for whom. In a lot of these trials and experiments we've talked through, we're able to do subgroup analyses that tell us this intervention was particularly effective for this population or that population, and it just helps us continue to iterate and improve. And then the final takeaway that I hope you walk away with is that driving these kinds of rigorous, empirical, impactful interventions is perhaps easier and maybe even more fun than you might think. So,
thank you.
Yep, go ahead.
Oh, sorry. Thanks
That's
so
okay.
much, Leah and Marta. I'm excited to go into the Q&A. I'll just share that my own tiny behavioral insight over doing this the last few months is that we get more feedback responses if I share the feedback survey form, not after the session, not after the Q&A, but before the Q&A. So I dropped that in the chat. It's really short. It only takes 1 to 2 minutes, and we really appreciate your feedback. So would love to hear from you about what you thought about the session and what you want for future sessions. I'm going to stop recording now.